Good evening, everyone. Today, as you all know, is World No Tobacco, and this year's theme is We Need Food and Not Tobacco. On this day, on behalf of National Institute of Mental Health and Neuroscience, we are having this live discussion so that this discussion benefits a lot of you who might be a primary user of tobacco, or maybe anyone in your friends or family is using tobacco and you may want to help them. Today, we have with us in this discussion that is produced by Mental Health Education Department of NIMHANS, we have two eminent guests with us. Dr. Sridevi is here with us. She is an assistant professor in the Department of Psychiatric Social Work, NIMHANS. And we have Dr. Padmavati. She is a senior nursing officer in the Center for Addiction Medicine, NIMHANS. I welcome both of them to the show. Now, tobacco is a very interesting topic for a lot of us because we have kept our whole career on it. We have been working with a lot of patients and we see how it is impacting a lot of people, be it the primary user, the people who are suffering from the second-hand smoke impact, or the family members. And both of you have decades of experience in this. And we see today's discussion with both of you. I'm personally excited and I hope it will add a lot of value to the knowledge that people have. And first to start with, very often people wonder why it is so difficult to quit tobacco. They make attempts, they'll be telling family members who use tobacco, please quit this, this is a bad habit. In spite of that, people struggle so much to quit. Why is it so? What does tobacco contain?
So definitely, as you were telling, Mr. Subhash, quitting tobacco is very hard. From what we have seen with our patients at Women's, we see most of them want to quit, but they struggle with the process of quitting, where they need professional help at that point of time. One thing is they have to learn that the brain all the time it is surrounded by a substance called nicotine, which is a primary substance which is present in tobacco. And we all know, like tobacco, when it is consumed in smokeless form, it contains more than 3,000 chemical substances which are poisonous. At present, the evidence also says that it is more than 9,000, not just the 3,000 in smokeless form. And in smoking form, it contains more than 4,000. Again, the evidence also tells it's more again. So, nicotine is a primary substance which makes the person dependent. So, when somebody wishes to quit, it takes a lot of time and energy on the person as well as the treating team. And when the person has to quit, as I said, they have to unlearn the process that the nicotine should not surround the brain. That is by stopping the use gradually. And at the same time, as they are stopping, they should take help. Like it can be like nicotine replacement therapies can be given where they give a nicotine gum or a nicotine patch which helps them to quit. And as you were asking, why is it difficult? Because there is a lot of craving that happens. Craving is something which most of them don't understand. There is no awareness where it comes like a wave. Any wave, it goes to a peak and then falls down. So when it is at peak, the person again tries to take the substance. There he or she should understand it is momentary, very much temporary. It fades away after the point of time. And we have to teach a lot of anti-craving measures to the person, like it could be some deep breathing exercises or talking to somebody over the phone whenever this trigger happens. And how to handle the triggers and cues is also one more challenge which we have to explain to our clientele.
Right. So basically, from this we understand, a lot of family members or caregivers will be blaming them that this is all in your mind. You should just make up your mind to quit. There is nothing called an addiction. There are a lot of misbeliefs around this. I think what you told makes sense that it is the nicotine, the chemical which is acting on the person, and we should understand that he is biologically getting this impact of the nicotine where he is struggling to quit. So it is not, it is just in the mind is a myth and we should give an appropriate care. Thank you, ma'am. That was very interesting answer. And madam, I have this question to you. There is a lot of awareness. We all understand that it is dangerous. But every year we see a lot of young people are again picking it up. We see some new customers into the brand of tobacco every year that are coming up. What attracts the young men and women to the tobacco product? Why is it? Is it tastier? Is it healthier? Nothing. But what is it that attracts them?
In fact,
it is the age. For example, what we understand from Global Youth Tobacco Survey, that almost 14.6% of users are students. So they are mostly getting into the habit of tobacco use, that too in very young age. So there are many factors. For example, any substance for that matter, and for now it is the context of tobacco, it is a biopsychosocial phenomenon. So there are biological factors, there are psychological factors, and environmental factors. So all these factors have certain risk factors and certain protective factors. So when the young generation getting attracted to the tobacco, it may be neurobiological aspects, wherein there is a social transition of adolescence into adulthood. So in during this social transition, the young adults tend to follow or tend to model the adults. Unfortunately, their brain wouldn't have developed enough.
Okay.
So the decision making or the ability to judge certain things, it's not still developed. So what happens is they tend to follow only the attraction, but not the impact. So which makes them get getting into addiction. And as man said, and it is an addictive substance which is already a reward system which works in the brain. So once the nicotine goes in, the reward system starts activating, and it asks for more and more, more and more, more and more. So once they start, it is just the journey just continues with taking more and more. And to add to that, there are certain environmental factors which are mostly risk factors that I'm going to talk, which includes maybe peer pressure or
Right.
peer influence for that matter, and even role models, their actors, their social media followers. When they post these things in the other forums, there is an attraction. It also adds to other environmental factors where easy accessibility and availability to these children, and we have elders using, so youngers will follow, and we also have certain perception in young adults that it is a normative, it's acceptable phenomenon
Right.
in the public using tobacco, be it in smokeless form or in smoking form. So that makes them all the more easier path towards going into using it. And it also adds to the other factors such as school dropouts, lack of parental control or parental monitoring, and also the macho kind of expectation that they have, if they smoke they will get, or the confidence they get, and sometimes even curiosity towards tobacco use. So all these factors actually combine together to makes them getting into this phase of smoking in the very young age.
Right. I think this particular topic that you were discussing was very diverse. Like Dr. Padmavati was talking about the biological factors, how it is affecting, and you very nicely summarized the environmental and psychological aspects of it, how they struggle to make a decision. Probably for young adults of 18, 19 are making a decision to pick up this tobacco. I think it's very important that somebody gives them the right advice and right information about it.
Actually, magnitude of substance use document from our own India reports that even children start at the age of 10.
Oh,
So, I mean, by we need not to go that far of 18, 19. Even by 10 years, there is the what we say, what we say is a gateway. Nicotine is the gateway, so which opens.
and madam, when we talk about people who are using at the age of 10 or people who are using, who are minors but they use tobacco, do you see family users, probably somebody using in the family, will make the availability much easier?
If they are using, yes.
Right. I think this is something very important aspect that we should, if anyone of the parents are looking forward, I think we can very strongly convey that if you are picking up any form of tobacco, it is very likely that you are increasing the availability of tobacco to your child. Can we say that?
Absolutely.
Right. Interesting. And madam, I want to continue this question with Dr. Padmavati. Madam, we say there are a lot of evidences for not just cancer. When we talk about cancer, tobacco, what is in the minds of people is tobacco causes cancer because it is very clearly printed on any tobacco packet you pick up. It says tobacco causes cancer, and now it has changed to tobacco causes painful death. So, apart from cancer or death or cardiac issues, I see there are a lot of issues with premature aging and other health impacts, or something that is very relevant to the younger populations. What are the other health problems or psychosocial problems that people get?
Before I answer the question, I would like to tell you that um, we did a study in Bangalore, so where we analyzed, like we went to the college youth age between 18 to 25, that is UG and PG students in Bangalore, and we understood like what is that makes them take these substances, what is the background, how much awareness they have about the health effects. Definitely, they didn't have answers for that, and they were not aware how much damage it can cause to the brain or body. And we all know like the brain matures till the age of 25, and whatever substances they initiate at school age or at college, they will definitely have an damage to the brain, which will be permanent.
Right.
And lot of cognitive decline, attention, concentration, memory, forgetfulness, these things, which is something which is going to impact them on a longer run, which they were not aware. So these consequences we have brought as a skill-based intervention model for this particular youth, and it can impact in any way. One is to add that they think it is glamour to use these substances. That is what they told in that particular discussions, and it can add to manliness, to have a cigarette in the hand and talk to a girl or a boy. It is manliness or something. There are a lot of myths that is there with substances, and consequences you see in young people. It can, if you see at the circulatory level, so it can have an impact on the feet and the toes, where it can cause bacterial infection, where the foot the fingers get gangrene. So this infection, sometimes we may have to amputate their fingers and toes also.
Oh,
There's no age, so it can happen to a young person also. That is one thing. And skin, premature aging happens. So there may be wrinkled skin, and if you see any smoker in a young age, you can see their lips. Smokers' lips, there will be a lot of wrinkles, hyperpigmentation will be there, and they may look old. And the skin viscosity or whatever, the turgor, it loses all those things. And when it comes to reproductive system again, in men, there is testosterone hormone which will be depleted due to the use of this nicotine, and they may not have the chances to reproduce. That is also there, and also they may develop feminine characters, bodily characteristics such as enlargement of breast will be there, seen in men, and they can lose the bodily hair, which they look more feminine. And if you see in women, it can again cause a lot of damage to women, where they can have menstrual irregularities. In case they conceive, there may be abortion, stillbirths. So these are some of the consequences that we see in young also. And most of the youth are not aware that this can lead to this kind of problems. And one more big thing is the consequences on lungs. So there is a chemical, as we already mentioned, nicotine is there, and this will added to that, there is carbon monoxide, which is which will become a barrier to supply the oxygen in the blood, and most of the people will get into respiratory problems. Later, it can turn up to tuberculosis and other respiratory failures. So these are the things, consequences which we see in young people, and definitely whoever smokes, they look more older, and
right.
even young people also may become older soon. That is
So,
how.
if any of our audience are listening, if you think smoking makes you look better, looks hot, looks younger, so Dr. Padmavati has clearly stated that it is not true. Smoking actually makes you look older, and you're more prone to acne, dark lips,
Yes,
yellow, teeth
psoriasis,
yellow neck,
eczema, yeah, yellowish feet.
yellowish
All these
teeth.
things will definitely not add to glamour. Later on, it will lead to lack of health consequences.
Right. I think, guys, if you are caring for your skin, your looks, I think quitting tobacco is the first step to looking better and
Yes.
looking more healthier. Right. That is very interesting, man. And, these are some of the issues that we do not understand. I also, since I closely work with the National Tobacco Commitment as a supervisor, we also see a lot of people telling that they are losing stamina. A lot of youngsters say, "Sir, in school I was a sports player. Today I struggle to play football, or I struggle to play Coco or Kabaddi." How much does this impact on people who play sports and other physical activities?
See, like anybody for that matter, they may realize when they are into these activities. Otherwise, also the tar, it's a globule, it is a tar which we can put on the road, same kind of tar material is there in the cigarettes or tobacco, whatever they consume, and it will get accumulated in the lungs, especially the alveoli. That is the air sac which exchanges carbon dioxide and oxygen. So there will be no proper exchange of gases, and definitely the person might feel restless. Small exertion also. A person who used to run for miles can't even walk. Can't even walk the steps, few steps. This we see young people also these days. They come and tell they have chest pain, breathlessness, and lot of issues where tar once it sticks, it takes years to get away from the lungs. Sometimes it may not also. So it is just the tar that is there on the road. So one has to imagine themselves. This is the consequences that can have on the lungs.
That is really hard, you know. I think this is something that we have to rightly convey. I think any youngster who is watching this session would benefit a lot. I think it will give them a new understanding on tobacco is not just about cancer or cardiac issues, but tobacco causes a lot of other problems that even as a youngster, as a healthy man, as a young man or woman, you can still experience. Ma'am, we understood how tobacco impacts us. What are the ways that it causes, socially, environmental impact, and how all these factors influence in somebody picking up the tobacco. But there is one thing that a lot of people tell. Sir, I'm using tobacco, but I'm not addicted. This is a frequent thing that a lot of people tell. I take occasionally. No, I just use, but I'm not addicted as such. So, how true is this? Can someone use tobacco and still not be addicted?
My answer would be both yes and no.
Okay.
I'll first say why it is no. In the sense, when a, any substance for that matter, and in this case tobacco, is having a face for addiction. So, if they are taking occasionally, and not all the occasional users can be into addiction. So, that way I mention no. But, however, my answer for yes, there is a possibility of they becoming addicted to from the occasional use phase is basically because this addictive substance has different stages. So initially it will be occasional use, then it will slowly move on to harmful use, and then it will go on to hazardous use, and then it goes out of their hand and they become addicted. So this is very thin line between these stages. So any person can flip into any stage without their knowledge. So one of the studies, American Journal of Preventive Medicine recently had studied, which said that even with the very many number of people who said they are social users and they use rarely, had the tendency to get addicted. In the
Right.
sense, they keep thinking about smoking later on the day, or they will be expecting that they will have a smoke, and when they quit, they have different feeling that they want to take. So even that kind of craving is sufficient enough to make them into addiction, even with lesser number. So yes, occasional users can be getting into addiction, and all the other factors will make them more prone, like unable to handle the stress. For every small stress, they think relieving stress through this mode is easier. So then, from occasional use, it becomes all the stages that I have said. So, on the whole, it is basically to say that it's better not to get into this mode of occasional use, because they won't know when they are getting into the mode of addiction.
Right. So, guys, if you're thinking that I'm just using occasionally, but I'm not an addict, but you should watch yourself. You never know when you would be getting addicted. So, as Dr. Sridevi rightly pointed out, there is a very fine line between being addicted and using occasionally. And madam, as a follow-up question, is there a safe amount of tobacco? Because some people tell me I use only 2 cigarettes a day. I think it must be safe. I use only 1 cigarette a day. I think it must be safe. Is there a safe dose or any amount of tobacco can harm?
Tobacco is harmful. That's the line. So that's where it ends. It cannot be healthier. It cannot be safer.
Right.
So that's the answer.
So any amount of something dangerous is still dangerous. There is no safe dose. If you are thinking 1 cigarette a day is cool or 2 cigarettes a day is safe, I think our experts are breaking that myth. I think we don't have any safe dose that is going to be keeping you away from health for impact.
It has no health benefits, no end of
Right.
the day. So it has only health impact, so no benefits. So it is not safe.
And Dr. Padmavati, I'll ask you this question. There are a lot of myths about tobacco usage. Some people say smoking is less harmful than smokeless tobacco. Some say I was smoking, so to quit cigarettes, I started chewing tobacco. Now I switched to something. I feel this is safer. Is there a difference between the two? Is any of one form different than the other? Because we see in GAD surveys, a lot of smokers have reduced. How does this impact?
You're right, Mr. Subhash again. Like according to gas survey 2, we see smokeless form of tobacco is used by at least 199 million of people, and the smoking forms are used by at least 100 million of people, according to that survey, which is again a welcoming move. Some people are responsible. Why I'm telling this is, so when it is smoking form, definitely it affects other people around. For example, second-hand smoking, if it is in the families or within the community, where person can smoke and let it out for other people. It could be for pregnant mothers or for the young children. So same consequences the other people also might face. That is one thing. And when it show, definitely it is going to affect them. That is the smokeless form. And these days people use two things. One is tiny, where the tobacco is put in a pouch-like thing, and they just chew and spit the packet once the tobacco is gone. And also snuff, that is easily available. But this is, even though the statistics has come down, it is very minimal number, and there is a long way to go. So both the ways, it is never safer. So I think the emission of these chemicals may be less, but it is dangerous to the person himself.
Right.
Same kind of consequences. Yeah.
Right. So if you're thinking to quit smoking, I'll take up some other form of tobacco. I think it is really not the way you can go ahead. If you want to quit your smoking, BD, cigarette, or any habit, quit it, but you don't have to switch to another form of tobacco thinking that, okay, this particular brand is safer than that, or this type of tobacco is safer than the other. Think, be it smoking or smokeless, any form of tobacco is absolutely
And
dangerous.
added to that, I wish also to tell there is one more substance that has come up in the market. It is not called snus. So the person can chew and swallow it rather than spitting it away, so that becomes a safe mode. And the age of initiation, still there is a dangerous risk where the people can start very young, maybe now it is school age 9 or 10 years. So silently they can take at the age of 5 or 6 also, in case they have role models within the family or within the environment wherever they see. That is really dangerous.
Dr. Sridevi, we were talking about how it affects oneself, and Madam was giving some information about how it affects people around us. Now, beyond this, I see the themes of World No Tobacco Day this year or yesteryear is about environment, food, crops, and all of that. A lot of people are actually surprised what has cigarette or gutka or tiny got to do with the environment. How is it affecting?
In fact, the WHO recently has released a report which says almost 8 million people die because of tobacco use. That's very alarming. And along with that, to the environment.
So that justifies why we titled this as tobacco pandemic.
Maybe, yes, yeah. So almost 600 million trees are cut for producing this particular product, and almost 2 lakh hectare land is being used.
2
And-
lakh hectare land.
Exactly.
That's a
And-
lot.
Exactly. And 22 billion water is being used. Almost 84 billion carbon dioxide is being released. So do you think environment is safe? So to add to that, we have tobacco industries, which is working day in and day out, producing more and more number of different varieties of productions. So the production phase, processing phase, delivery phase, packaging phase, all these phase is actually very alarming to the existing global warming. So to add to that, even the littering of tobacco is really alarming. Be it cigarette butts and filters which are thrown into the rivers and ocean. They are the huge, and they are in landfills, they are in sidewalks, they are in sashes are everywhere. The aquatic animals are affected. Um, Animals, otherwise, and human beings, everybody are affected, and whole environment is polluted because of that. And moreover, production industries actually have releasing the waste, which goes again to the landfills and the rivers, which are again very alarming. So I think one is the usage, how it impacts our own lives, and the production and distribution impacts, and even discarding impacts the environment.
Right. I think this is a very interesting topic for a lot of us to think upon because we only think tobacco as a product that harms oneself. But when you're giving the numbers, it is, I'm personally shocked to understand how many trees are cut down, how many gallons of water is being used. We do a lot of campaigns on save trees, save water. I think now it's also important that cut down tobacco so that you also save environment.
Absolutely.
And also now what you'd say makes sense because if we go on any road, what we see as a major garbage problem is a tobacco sachet or somebody spitting on the street, or a
Roads.
pack of cigarette, or the wrapper, the fine plastic wrap that is on the cigarette. I think it's very important that every day if you are smoking one pack of cigarettes, I think it's very important to understand where this one packet of plastic is going,
Yeah.
where those 10 cigarette butts, which could be thermocol, I guess,
Yes.
so where is it going? Any birds or animals, are they swallowing it because you're putting it on every road? I think this is a very different perspective
Very
that people
alarming.
have to think.
Very alarming.
Right. So this way, not just humans, not just you and your family members, the whole world, all the animals and birds are being affected. Guys, I think it's very important.
The whole
If
ecosystem.
Yes, the whole ecosystem. I think if you're an environment lover, if you're smoking a pack of cigarettes and discussing about how to save the environment, I think we should call out on the hypocrisy and we should cut down on the tobacco usage so that you become a better person for the environment. Dr. Shridevi, I think this is a very good, important information that you gave. I think this will impact the people in much different way. We're talking about health benefits, psychosocial impact. I think environmental impact is that something that was very less discussed in the past years. Thank you for giving this information, ma'am. And madam, we were talking about, Dr. Sridevi was also talking about the influence of media and how youngsters pick it up. There are a lot of rules and regulations to ensure that minors do not consume. How people cannot sell tobacco within 100 yards of the educational institution. There is a public ban, COTPA rules are implemented successfully. But in spite of that, do you see there is a lot of influence of social media or the mainstream movies or television which is helping people pick it up or promoting it in any way?
Definitely. As I said, the same study again I would like to quote, where most of the youngsters, when we interview, they tell like we always look upon the people. It can be our heroes or somebody in the media whom we always follow them. So they become our immediate role models where it looks nice on the screen. No? So
Right.
off screen also they want to model their behaviors and they don't know the consequences. They definitely play a role. So it would be glad that in case these media people who are the celebrities, they can come and show the other way around. So that can help the young, because we are losing a lot of young people to this menace where they easily replicate and become victims of this particular thing. That is definitely there.
And I think I have read a bit about the Godfather laws. If any movie that I look at, the hero or the actor or the heroine goes and buys one cigarette from the shop. But Godfather law says you cannot sell loose cigarettes. It should be sold in packets. And we see the people smoking near colleges or the people smoking in a public place. This is all against Godfather. I think do you think the media industry should be more aware about the laws in the court and show the environment to fit these laws?
Definitely, they can be more responsible in making these decisions or by portraying it. They should be more responsible to protect this young generation. At the same time, Even though we have these laws existing, in practicality, more than stationery shops, we can find any small outlets where they sell cigarettes or gudka or whatever, smoking forms or smokeless forms are easily available in spite of having this ban. And how frequently they have to be checked and what policies have to be implemented is something which has to be looked upon.
Right, ma'am, coming to CODPA, if there is any such violation of CODPA, whom should the people report to? Whom should they complain to?
One is they can directly go to the nearest police station and inform them, especially when it is around the educational institutions. That is one thing. And provided that they take action immediately. Otherwise, people also lose interest in going and complaining.
Yeah, law enforcing authorities
Yeah.
are the one whom they should intimate. But there is also another side to that, that the citizens' responsibility matters a lot.
Right.
So whether it is for themselves that they are buying, or whether they observe small children, minors buying in the public places, or minors smoking in the public places, maybe they should intimate to the law enforcing authorities about this, so that some awareness or some actions can be taken against such small outlets, because its population is so huge that, and our manpower is also limited. So expanding their supervision becomes little difficult. We also need to understand. So it becomes every citizen's responsibility to utilize these laws and enforce it by themselves, or use the authorities to just inform and take it forward from them.
So, like liquor, it is not very much regulated because it
Yeah.
doesn't need a license to sell it, and a lot of people who are selling probably are not aware of
Definitely.
several
Yes,
CODPA rules.
yes,
I think that enforcement and that education has to be given. So now we understand the education on tobacco cessation is not just important for a teenager or a
More awareness.
more
At the
awareness has
community
to
level.
go to the sellers also. So
Yes.
that is a important factor that we can think of. Madam, this year's theme is grow food, not tobacco. Can you give us some more inputs on this? What is this? Why? How did this theme come up with?
What we understand now is agriculture is always manpower building, and also it helps in survival of the people. But unfortunately, tobacco growth is a commercial crop. So many uh, people look for getting commercial benefits out of these kind of crops than growing food, which is very unfortunate. And it also, as I said, takes lot of land to grow the food that's supposed to grow, and the water supposed to be used, the farmland that's supposed to be used for growing food is being utilized by tobacco plants. And it is not any one individual or two individual. There is a big tobacco industries, tobacco users, mid users who are in the process of producing it, all are involved in this particular problem. So that is why I think it is very alarming to see many uh, organizations, be it government, international, private organization, coming to know that more than food, it is tobacco being grown in different outlets. So I think this is very important. I mean, theme that WHO has brought, grow food, not tobacco, so that at least the awareness will start building the impact of tobacco. Like this is our effort to make community understand the impact of tobacco. So I think this way, by making this as a theme this year and worldwide, so I think many people will understand the bad impact of tobacco and the need for growing more food, because we still have scarcity of food in especially lower income countries. Maybe this particular message will go broad and wide, where people will accept this need for growing food and not tobacco.
I think now we are transforming into a very socially concerned themes of World No Tobacco, right? Last year it was tobacco, a threat to the environment, and this year grow tobacco, not food. Because people have not thought beyond their health problems. when it comes to tobacco. When you said a lot of countries are struggling to get sufficient food, and tobacco is taking up a lot of land that where food can be produced.
And
I think it is
also,
very heart touching.
Subhash, I would like to add, like tobacco, once you have to cultivate it, at least takes 9 months to 1 year.
Hmm.
So ours is a country where we are more dependent on agricultural land and farmlands, where 1 year just goes up for this one particular crop. From the time this crop is grown, they spray a lot of pesticides. Again, the land becomes like you can't
Unfit for other crops.
other crops, and you can't grow seasonal crops. We are more dependent on seasonal crops because based on the rain or whatever. So we should bring more awareness in the farmers rather than producing tobacco. This has to be more sustainable to grow food crops. That is what we have to give the message to the farmers also.
Right. So now I understand, like tobacco, even tobacco growing or the cultivation is also addictive. So the land is getting addicted to the tobacco cultivation and it is becoming unfit for the production of other crops. Okay, so I think this is one information that we need to give a lot of input to, and
Yeah, especially should reach the rural community and farmers also.
right. That is an interesting thing to know. So probably people who are watching can give this information and communicate to a lot of other farmers or anybody who is using this growing tobacco. I think we should also take up that responsibility and push out some awareness. Thank you, ma'am. And madam, continuing with the question. So we understand, but there is a lot of problem that loved ones or the primary caregivers or the family members of these users face. They say, so we are putting a lot of effort, but they are not ready to quit. We are struggling, we are trying our best to help them quit, but that is not happening. So, what should the loved ones, the family members, or the caregivers should do when their child or their spouse or a parent is taking tobacco?
Okay. Maybe all of us can
Yes.
contribute to the system because all of us are in the system. So, from my point of view, I think it is a collective decision that everyone has to take. It is the individual, it is the family, and it is the community. So, all will be the partners in helping the person to quit tobacco. From the individual point of view, I think he or she maybe may try to do it through own motivation, enhancing their own motivation or a commitment to quit or willingness to quit. So if they have come with that psychological state of mind or stage of change that they want to come with, then I think taking the mental health professional support in the process would be very, very helpful to them. So there are pharmacological treatment, maybe in the form of nicotine replacement therapy, and certain medications to support the withdrawal phase, so they don't feel the difficulty one would go through otherwise because of the withdrawal. And then they also can take support from the counseling system for many other motivational enhancement. There are very many techniques that we teach in any health center. So, and mental care professionals do teach various techniques. If I have to just briefly give 4 Ds, we say very simple ones. Delay your smoking, drink water when you have the thought of smoking, and deep breathing when you have the thought of smoking, and distraction. So if they can make an effort, maybe along with the support of mental health team, it will
So
help
it can
them
be
to quit.
another D. Discuss with a mental health professional.
Exactly. Yeah. Discuss. So these things they can follow, and when it comes to family, there should be an acceptance. If this is that it is a health problem, then they will also support in the process of treatment. They will also help in taking him or her to the follow-ups or to the doctors or support that can be surroundings, and also educating the peers when in the process of quitting how they have to support, and one's own internal craving when they are working out with that internal craving, family also can support by not doing by themselves. So like there is they have also have to learn to stay away from all these factors. So these are the few things that can be helpful, and maybe ma'am can add more and you can talk about quitline services.
So, and these days, children are not aware of how to handle their emotions in a healthy way. So how do they solve their problem? Problem solving skills. It could be stress management. It could be time management. These things definitely they lack, and also lifestyle management. That is something people uh, they use substances. I'm not telling they can't eat outside, but they most of them crave for food substances that are readily available. That is also is not a right choice. So lifestyle management is something which we have to invest more time on. So primary prevention is a focus of the day. It should be there so that we need not spend more money on secondary prevention or tertiary prevention, where a person already he or she will become dependent and addictive, and lot of money, time should be invested in treating this person.
I think to add on to the services that you spoke about, along with the primary health centers, along with mental health professionals who work in OPD setups or hospitals, I think it is very important for me to bring in the topic of the National Tobacco Quitline Services. So here on every tobacco packet, as you see, there is a phone number, but very less people are aware about it. And every day we get 150 to 200 calls on the helpline. A lot of people call thinking that it is a company's number. They call up and say, so the number of cigarettes are less. Kadme cigarette is there. What in the tobacco packet there is something else. The quality of the tobacco is coming down. People say all of this, along with definitely, of course, along with a lot of genuine people who want to come. There are also quite a lot of people who are not aware about it. So probably it is very important whenever you spot somebody smoking on the street, you can tell them that there is a number on the packet. You can call them. Instead of getting into conflict with that person, instead of criticizing that person, probably you're traveling in bus or train, somebody is sitting next to you and chewing tobacco by the window. You can just tell them to call upon the number which is there on the tobacco packet. I think that is one way you can develop that awareness. You can do your contribution to the society by bringing up this awareness in people. And when it comes to tobacco quit line, it's a toll-free number. You don't have to pay to talk to a mental health professional or get any help. And overall, it is on the phone, so your privacy is maintained. You don't have to come to the hospital. You don't even have to tell your family or parents. For
Yes.
example, any adolescent or teenager is into the tobacco habit. They don't have to ask their parents to take them to a mental health professional. They can just call us up and seek telecounseling. I think that is one service I urge a lot of people to take it upon, take benefit of, and I also urge people who are watching to spread this message. So if you think tobacco quit cessation is hard, it is not at all. There are multiple ways, multiple avenues one can access these services and reach out to a healthcare professional and take the appropriate support, and quitting is definitely possible. There is no addiction that cannot be quit.
Yes,
Can I say that?
definitely.
Right. Madam, what is the other role of individuals, family members, and community? We can all add on to this. What can they do? How do they handle? As a neighbor, as a teacher, as a seller, as a bystander. What are their roles? What can they do? What are their responsibilities per se?
Yeah, as I just mentioned, first of all, it is individual's responsibility, which plays a major role. And to add on to that, there are a lot many times family not knowingly or not being aware of the fact have a tendency to criticize
Hmm.
or comment on the behavior. So he or she would have got the habit because of some reason or
Hmm.
because of some stressful event, like Madam said, relationship issues or many other reasons, which the child or adolescent is not in a position to share. So, but would have ended up into the habit of smoking or using chewable tobacco. So the family need to understand that criticality cannot be healing or leading to any help. So it would rather be understanding the person and providing the support which in whichever the way the person is asking, or they can have a discussion how best they can come into terms. It is not that they have to live it today or tomorrow. So they can do it in a process. It can be a process, and the family also should give enough time, and family also should have trust. So if the person goes out and comes back trying to smell him, sniff him, to see that have you taken, So these kind of certain activities sometimes may irritate the person when he or she has not done it. So since, however, family is not believing me, so why should I leave it? So it
Right.
can other way impact. So being very genuine, being very transparent between themselves in discussing will help than hiding or being critical. So either way, it will not help. So that would be another maybe information from my side to the family. And when it comes to the community, as we know that the Code Act supposed to be far away from the educational institutions, and it has to be not selling it to the minor, and there are certain banned items which should not be sold. So some of the citizens being aware of this, or some of the shopkeepers or sellers being aware of this, can try not doing that. They can, I mean, sell some other things which can give them the benefit. But maybe the family or the community people themselves can intimate, like how we discussed, to the law enforcing authorities. One more thing that I would like to add here is the tobacco industry, which in fact is bringing up lot many ways to attract these people in the form of advertisement, in the form of using the celebrities to be the models. So, and it's somewhere lures, or
The
it's
surrogate
somewhere,
advertising,
yes,
for
yes,
example.
yes, surrogate advertisement. And some of the social media also do not have any control on the content. So to give that an example, like almost 34% of the Facebook content is involves tobacco use usage. So this kind of social media usage is also somewhere very alarming. So I think those who are following also should be very much aware of not heeding to these kind of attractive advertisement. So that is the responsibility of the person, and also that is the responsibility of the media, how they have to portray and how they have to not attract these youngsters into this, or track them into this social media
Right.
coverage.
I think I want to reiterate what Dr. Devi was telling all this while. I think families should develop and create that open space where your child can come and tell you that I tried this. I want to get out of this habit. Just like how concerned you are when your child says, I fell in the school, or I had a health problem. You're very concerned. I think the same attitude should continue when your child says, I'm using tobacco, or I got into this habit. When you create that open experience or an open environment where they can seek help to with the parent, I think a lot of people can quit in a much better way. And yes, if you're on social media, if you're watching movies, I think you should be very aware of what you're subscribing to. If you're not mindful about it and picking a wrong habit, I think it can definitely lead to a lot of disastrous experience that we all may regret. Madam, what do you say about these things?
Added to what Madam said, I wish there should be lot of awareness in the community. At community level, lot of awareness campaigns should happen, not just on the word no tobacco day. Otherwise, also some people should become more responsible. For example, it could be a bunch of school children taking just the placards.
Hmm.
That shows how responsible they are towards the society. Or it can be college campuses where young people can be identified as gatekeepers within their communities, and they become the stakeholders to bring this awareness within each college. That becomes more important. And also people who have success stories, that also can be told to their peers or something, where easily they can get the inputs from their own peers. That acceptance will be more when their peers tell that. That is one thing. And also, if somebody has sought help, for example, from NIMANS or from a line, they have to bring that awareness. It is individual level as well as at family levels, at community level. They have to. It is like a whirlpool effect. It has to create in the community. Only then we can reach to the masses. So that is important. Not just one particular day or occasion. It can be done on very frequent basis. So that awareness is something we have to work on.
Nice, ma'am. I think this one point that I want to pick on.
Yeah.
It is a very nice thing that you told. I think educational institutions should focus on developing students into gatekeepers. We spoke about the peer influence and peer, influence on picking up tobacco habit. Same way, I think there should be a peer support to quit.
Some of colleges they do have a peer volunteers. They identify them as peer volunteers. They educate them on lot of these information, and they accept them easily rather than we as health professionals going and talking to them as an outsider. No, it's better.
True, it is very easy to tell a friend that they
Yeah.
want to quit than to a health professional or a teacher or a academic counselor per se. And also, you were telling, I think, not just people who receive support from Enhance OPD or Enhance Quit Line. I think it's very important. A lot of celebrities who are quitting for their health concerns, fitness concerns. I think it's very important. They also come out and say, "I have quit." Or
Yeah.
people who smoke in the movies come out and say, "I do not have such habits. I've smoked only for the sake of movie or only for the sake of character." I think that whirlpool makes a lot of impact. I think a lot more people can look forward to it. Yes. But anything else, we discussed a lot of these things. Anything else that you want to add on to this? Any other questions or experiences that you have come across and you want to share a bit?
Your training program.
Whenever we conduct training programs, not just the tobacco, other substances, it could be alcohol or whatever, multiple substances, and how it is impacting the youth. Most of the people come like they don't know where to seek help. That is
Right.
something which I feel sad at that point of time because help is available and people are not aware. So even though we,
And
yeah,
madam, there is this very particular concern of people who want to seek help. Will my data be shared? If I call the quit line, will you record it and put it on a radio channel, or will
lot of
you?
stigma.
Yes, there is this fear of privacy.
Yes.
How private is it, a telecounseling, or how private is it when they come and seek treatment in the OPD? I think we should also add some input on this.
Whosoever comes to Nimans, definitely their information will be kept confidential
Right.
and we never share about them and we don't judge anybody who come here. We see them as a person and they come with some particular illness or a problem and we just focus on the problem and we help them. And also one should understand relapsing is part of the treatment process. Most of them think like whenever it comes to tobacco use, I relapse quickly.
Hmm.
I had some sad emotion, I relapsed. I had some happy emotion, I relapsed, especially in the young people. So it's okay to relapse, but still you have to come for follow-up, take treatment, meet your mental health professional assigned to you, or you can just walk into the OPD. That's very important. Follow up, whatever may be the reason. And if you're fine and you're functional, you're happy with whatever you are and not using substance also, it's fine. You better come and meet the therapist. That will boost your confidence. On a long term, you may not relapse also. That is something which they have to follow.
And also when it comes to, I think I want to say the same about the quit line. Anyone who calls the helpline, their information and the information that you share us over the calls or the recordings will be kept absolutely confidential, and that wouldn't be shared with anybody. And also, it's very important that one takes the follow up. Once people quit, they are prone to take up such habits again. But it is very important that you are in the continuum of the treatment or the counseling, and no matter any other mental health issues, be it any psychosocial issues that they are facing, should not be a reason to pick up that habit. So in all such cases, Imhans also has a center for telemanas where they can call up and seek help for their other psychosocial problems. I think it is very important that people are also aware about this and not to see tobacco as a solution. So many problems, one solution is not the way it works.
And also there are added support systems that are available in the form of yoga, meditation, relaxation techniques,
Right.
and reaching out to any other lay counselors in the those who are available in the public forum. So as sometimes reaching out to a tertiary care center has its own pros and cons for some people, maybe in terms of distance, maybe in terms of non-availability of slots and etc. So maybe utilizing the tele services is one thing, and apart from that, using all other helpful habits will really an added boost for their uh, process or the effort to quit. So maybe they can add their lifestyle modification through these methods also.
Anything else that you want to add on to this?
I think that should be fine.
Yeah.
Thank you. I think in the last 1 hour, we had such holistic view on the tobacco cessation. We spoke about why it is addictive. We spoke about why it is difficult to come out of it. We also spoke about what is so attractive about tobacco, and we also broke quite a lot of myths. Like tobacco is cool, tobacco makes you look manlier, hotter, handsome. We understood why it is not true. We also broke myths about how there is no safe dose of tobacco. We very importantly in some of your answers, we understood how tobacco is impacting everybody, the birds, your pets, for example. We understood how it is impacting the food production. Probably how you're smoking or you're chewing tobacco is impacting somebody else in a far off country because, in the terms of food production, that was very heart touching. I think this should hit the people very strongly, and these ideas should imbibe in them where they seek help in a larger number. And we also spoke about the ways one can reach out to us, to the helplines, to the OPDs, to the primary healthcare centers. We also discussed about how all these things are totally confidential, and we have such empathetic staff and consultants who take care of your addiction and who do not stigmatize or do not see it as a taboo. I think probably after watching this video, one should be able to develop a deeper understanding about their habits, be it yourself or for your family member. And I hope you will be open to seek help. Thank you, all of you, for watching this session. And I hope this session was beneficial to all of you. And I hope all the information that we received would be put into the practical use. You will be gatekeepers of tobacco cessation, where you develop an awareness and give some information about a quit line or a helpline to people whom you come across who is using tobacco. Thank you all audience. If you have any questions, you can comment below, and we hope to deliver a lot more educative sessions like this. Thank you all of you. And thank you, Dr. Sridevi and Dr. Padmavati. You gave a holistic approach and a lot of interesting views. I hope our audience